There will be some repetitions, obviously, but it's meant to bring in and get a point in. On me demande souvent quelle est ma vision pour notre institution dans mes fonctions de président-directeur général. Qu'est-ce que je voudrais que cette institution devienne? Our strategic plan identifies our vision to become globally recognized for patient-centered innovation. Let's break that down. I will not define globally recognized because I think everyone knows what it means and it's already started quite intensely. What patient-centered means to me is that everything must start with the patient needs and end with better care. Mais précisons. Les patients eux-mêmes et ou leurs familles doivent participer à la confection de leur plan de soins. When we speak of innovation, we don't mean doing something new just for the sake of doing something new. That is mere novelty. It attracts a great deal of attention, at least initially, but it doesn't last. It means embracing new ways of thinking and introducing new ways of doing things that lead to better results. It is a process of engineering improvement, using the best ideas and tools at our disposal. Maintenant, voyons ce que nous avons accompli cette année dans la réalisation de notre mission. Plusieurs nouveaux modèles de soins ont été mis en place et ont directement amélioré les résultats pour les patients et leur expérience, tout en rendant le système de soins de santé plus efficace et efficient. Key to this was the adoption of a hospital without walls approach. This approach compels us to develop ways of providing care that extend beyond the confines of our buildings and brings care to where the patient needs it most. An excellent example of this hospital without walls approach can be found at the Crisis Intervention Service within our mental health and addictions program. Crisis intervention is now using video conferencing to provide immediate crisis assessment and counseling to clients outside of Greater Sudbury. And clients using this service can access in real time the expertise at HSN and receive the care that they need right away, right where they are. The hospital without walls philosophy is also at the heart of our care transition model. In this model, care providers will do in-home follow-up visits and assessments with frail elderly patients for at least 1 month after discharge from our facility. David McNeil, le vice-président des programmes, ainsi que ses collègues, y compris des pharmaciens et des médecins généralistes de la communauté, le système d'ambulance, CCAC, les CSS, des représentants de patients, travaillent ardument pour faire en sorte que le modèle fonctionne vraiment. Un autre de nos nouveaux services, la clinique d'évaluation et de soins de courte durée, est un autre exemple d'un hôpital sans murs. Cette clinique est située au centre de soins ambulatoires de Sudbury, est un guichet et offre un guichet unique offrant des divers services pour les personnes âgées, de santé fragile, après qu'ils aient reçu leur congé de l'hôpital. There was also significant progress made in health research at HSN. Substantial funding was secured this past year for research-related infrastructure and equipment, as well as research projects. AMRIC, the research arm of HSN, and its researchers attracted millions in funding for vital research projects that will improve the care we provide to patients. Parmi les projets de recherche, mentionnons un vaccin contre la nicotine pour aider les gens à cesser de fumer. de meilleures méthodes pour détecter et traiter les maladies infectieuses dans les hôpitaux, ainsi qu'une étude des nouveaux modèles de soins pour les personnes âgées de santé faible qui sont hospitalisées. IRMAC a également conclu un partenariat avec la compagnie Electa, un chef de file mondial dans les technologies de l'information, afin d'ouvrir un centre d'innovation à Sudbury. In addition to research grants, AMRIC received over $7 million for infrastructure and equipment from our community partners, including the City of Greater Sudbury, the Greater Sudbury Development Corporation, the Northern Ontario Heritage Fund, the Northern Cancer Foundation, and the HSN Foundation and the HSN Volunteer Association. One of the most exciting research development this year is HSN's launch of a personalized medicine program. Now, personalized medicine uses advanced gene component sequencing and analysis to customize a patient's diagnoses and treatment according to their individual gene makeup. To oversee this new frontier in healthcare, HSN successfully recruited Dr. Rebecca McClure from the world-renowned Mayo Clinic in Rochester, Minnesota. And AMRIC, and indirectly HSN, ensures that researchers have access to the appropriate infrastructure to carry out their core activity, which is research, especially at the beginning. Et Horizon Santé-Nord continue d'attirer de nombreux talents à Sudbury. En plus du Dr. McElhaney, le gériatre, et le Dr. McClure pour la recherche et la clinique, nous avons réussi à attirer 2 chirurgiens spécialisés dans la chirurgie du foie, dont le dernier en provenance aussi de la clinique Mayo, ce qui fait en sorte que nous avons eu l'aval de Cancer Care Ontario pour créer un nouveau programme qui sera subventionné. Je m'en voudrais de ne pas mentionner un autre programme, le sarcome, ou cancer des os, aussi accepté par Cancer Care Ontario, et HSN agira comme centre satellite. Et ce n'est que le début. Et ce ne sont que quelques exemples des nombreuses réalisations positives qui ont eu lieu à Horizon Santé-Nord au cours de la dernière année. Now, all were driven by a desire to be innovative and effective in providing healthcare. All were structured to be more patient-focused. That drive to be more patient-centered will continue this year. We will pay special attention to our pediatric patients and family members. This spring, we introduced the Northeastern Ontario Health Centre for Kids, shortly defined as NeoKids. Under the new NeoKids banner, we shall start by relocating all the pediatricians' offices and outpatient clinics to a new larger space at the Ramsey Lake Health Center. And by having all outpatient care for children on one site and pediatrician in closer proximity to our inpatient pediatric services, we can better streamline care for kids and their families. As I said before, we think that huge progresses have been achieved in the last year. I can only hope that the community, both externally and internally, recognizes and perhaps acknowledge how important and how fast these progresses have occurred. We could not have succeeded without the outstanding contribution of our staff, physicians, volunteers, and healthcare partners. We have benefited from the stellar fundraising efforts of the Northern Cancer Foundation, of the HSN Foundation, and the Volunteer Association. And I would be remiss if I did not mention our strengthening links with Laurentian University and the Northern Ontario School of Medicine. An academic health center does not function very well otherwise. Soon, you will see at all entrances a new plaque, in addition to the one that Mr. Picard proposed, signifying this link with the 2 teaching institutions. And in the same vein, I want to acknowledge the tremendous support provided to AHSN by the Council of Academic Hospitals of Ontario, called KO. Je répéterai ce que M. McCann a mentionné. Je m'en voudrais si je ne mentionnais pas aussi de façon particulière le travail exceptionnel accompli par les membres du comité aviseur des patients. Ils sont responsables de plusieurs changements dans le fonctionnement d'Horizon Santé-Nord. At HSN, we believe in patient-centered care and innovation because we cannot do otherwise. The healthcare system must evolve to meet the needs not only of today's, but also the future society. If we do not adapt, we will not serve the best interests of the patients. We will have failed miserably. And our goal is to ensure our patients enjoy the best level of health possible. And to do that, we must be the best institution. And this goal, HSN will pursue it relentlessly. We do not have any choice. Horizon Santé-Nord doit continuer de s'appliquer à réaliser son potentiel à titre de centre universitaire des sciences de la santé. Ce faisant, il excellera et se classera parmi les meilleurs hôpitaux du pays. Merci beaucoup.